Many years ago, I gave a lecture in my 30s, so probably close to 20 years ago. I gave this lecture when I was just starting practice. And there was an older gentleman at the time. I think he's still in practice. I think at the time he was probably 60-some. He's probably 80-some now. And he gave a lecture about giving patients only what they want, not what they need. Now, clearly, the other saying in my line of work that my mentor always taught me is, I'm not in the business of need, I'm in the business of want. In other words, I don't treat cancer or heart disease, something I say all the time. I treat desire. I treat, do you want a facelift? Do you want fat grafting? Do you want a hair transplant? Do you want something to make yourself look better? So that's one thing. But the other thing about need and want is, what he's trying to say is when a patient comes in, they are asking for a rhinoplasty. Don't talk to them about a facelift because that may be offensive and that may be something that they don't even care to think about, and you shouldn't bring it up. Now, I think that is actually probably reasonable in certain respects, but I also, when that gentleman said that, I was on podium and I said, well, I give patients more what they need as well as what they want, and that's something that maybe a bit offensive, maybe a bit weird, I don't know, but I want to articulate that. And I think if you've known me through these video series or known me as a surgeon or a physician of yours, you'll know that what I'm saying is accurate. So I talk a lot about basically helping patients be better off. And a great example is yesterday, I had a patient that had a motor vehicle accident a year ago with pain, anxiety, and a deformity of her face. Now, when I looked at her, there wasn't much deformity in terms of the face being a little bit more sunken on one side, but she had sort of chronic pain issues, and I could tell she had anxiety, so I asked her if she had a clenching and grinding. She says, yeah, it's a lot of anxiety sitting in that area. So I try to give her advice of what would benefit her the most, which to me would be first fixing the pain, and I was able to fix it instantly using Botox with the technique I invented to knock it out. And the second thing I said was, I really advise you to do the treatment for anxiety. But I said the problem with the filler is I didn't think it looked that bad, number one. And number two is I was worried that whenever we try to work on symmetry, patients are never happy because I could try to fill it and she'll come back and go, it's not quite good enough. I need a little bit more. Could I need a little bit more? And so I try to help guide her on what to spend the money the best. And that's another video I shot called Facial Financial Advisor, which is relevant to this video as well. But this video is talking about a few concepts. One is needs versus wants. And so the needs, patients don't need anything. I mean, I guess she did need it because she had pain. But what I'm trying to articulate is I try to give patients the best that I can. And that is pointing out things, not necessarily what they may have brought up. Which brings me to the other concept I wanted to present in this video, which I call low-hanging fruit. So I use this expression quite often with patients. And what that means is, hey, this is something else that it's a particular, maybe a small add-on to what is there that I think would make a big difference, may not cost that much. Example is a lady today that came in for consultation. Her sister had come in for fat grafting and eye bag removal about, I think, 8 months ago. Very happy with the result, and so sent her sister here. And the sister was here mainly for her upper eyelids, wanting her upper eyelids to look a little bit better. And I said, honestly, for me, adding volume around your eyes is going to be so critical that just removal of a little bit of skin from your upper eyelids really won't be enough to make the impact that you're looking for, especially it won't balance your lower lids. And she was Asian. I said, for an Asian person, the problem with it is that the upper eyelids really won't look right. When you just take a lot of skin away, it's not going to look appropriate. I really needed fat grafting. But then I mentioned to her what's really low-hanging fruit. She had melasma. She had skin quality of skin that really, I think, detracted from the way she looked. And I thought what would be really powerful for her would be a little bit of Botox to start realigning some of the issues with melasma, which would take a little longer, probably on the order of 2 to 4 rounds. If you don't understand what that means and you want more interest, talk about that. I listened to my 25-minute video on Botox that I shot as well. But basically, I try to give her some advice, and I thought about this video topic, low-hanging fruit, which I use that term often, which basically means, this is something easy, that's not that expensive, it'll make a dramatic impact the way you look. and that would be opposed where she actually would benefit from a facelift. She had some neck sagging, but it wasn't tremendous, and a facelift is much more expensive. So I didn't really talk to her about it because I thought, hey, that's outside of the spectrum. I mentioned that I could do it, but if there's very little interest in it, I could tell she's someone that really is not looking for a lot of cosmetic changes. She's, so I thought, this, a facelift is not low-hanging fruit. It's much more expensive. There's involvement of, a surgical procedure that she's probably not interested in. So I didn't really bring it up to her, and that's a great example where I don't think there was a benefit for me to bring up that topic. But the skin therapy, it's something that I brought up, and I thought, hey, that's low-hanging fruit. Same situation other day. I mentioned this story in my video because it was a consult I did yesterday for a lady that she came in for acne scarring, and I looked at her, and I could see that she clenched and ground her teeth, because something I can be in a restaurant, and 20 feet away I'll look at someone, I go, oh my goodness, I can tell they clench and grind, and I could see that she did, and I thought, oh my goodness, I got to bring this up to her. So I did, and she says, oh my God, you don't know how much pain I'm going through. I'm clenching and grinding. So look, for me, that's low-hanging fruit. We should really treat that. In fact, that's probably even more important than just your acne scars, because I really want to give you some relief. And I did do it, and she's like, oh my goodness, it's like unbelievable, because it's instant relief. So low-hanging fruit, you'll hear me use that term. You'll hear me talk about needs versus wants. These are just concepts of how I relate to patients and how I talk to patients. And of course, as much as you select me as a surgeon or physician, I'm also selecting you as a patient. We have to have good rapport. You have to sort of buy into my philosophy and my approach and my strategies. A lot of my patients really understand it and appreciate it. Other patients don't. A great example is a patient of mine who sends me a lot of patients. And she says, a patient was very angry at you last week. I sent her, and I said, I know who it is. She walked out of my consultation, and she said, yeah, that's the one. And so what happened was, this lady had come in for fat grafting. As you probably know, I wrote the world's most popular textbook on fat grafting in 2006. So I do quite a few fat grafts, but she had very unnatural lips. And I just mentioned it to her. I said, I'm not trying to force her to do lips, but I'd said, part of the thing, I don't know if you know this, that your lips look a little bit unnatural, and it's something that I could dissolve if you're interested. Now, of course, that is probably offensive to some people. They don't want to hear that. And those that really don't want to hear my honesty, they probably shouldn't be here as a patient. I'm not here to tie you down, although I probably wanted to, so to speak, tie you down to fix something. But I think it's worth my telling you something that is there. You're not paying me to be your friend. You're paying me to be honest with you and to give you advice that I think would be helpful for you. And that's why I'm here. I mean, if I just tell you, give you fake compliments, then that's absolutely not why I'm here. You can have a friend do that. You can have someone else tell you that you look amazing, but I'm going to help you, guide you on what would be the best for you. But I'm also going to be appropriate as part of this context of needs and wants. Is, if someone is with a little bit of neck sagging and all they really want is a rhinoplasty, I get a sense of where people want to be. I'm not going to bring it up. I'm not going to go into deep dive onto the facelift. I may just briefly mention if it's significantly saggy, just to mention, hey, look, that's something I can do. But I'm not going to go and spend 30 minutes discussing a facelift when someone's here for something completely different. But if there are things that cosmetically I could improve, I may mention it. And so even if things don't look quite right, I will mention it. A great example too, a lady the other day, actually this was yesterday, came in for a consultation for a hair transplant, and she had some scarring. And I thought, I would love to do, I said I really need some fat grafting to actually build up the area that's too bony, that doesn't have adequate soft tissue below it for the graft to survive. And I really only mentioned this probably 1% of patients. So I said, by the way, while I'm there, I can do some fat around the eyes, and I explained what that is. And then I said, I hope this is not offensive, but your cheeks also look slightly unnatural. I would dissolve some of them. And she says, really, I've only had fillers years ago. I didn't even know they looked unnatural. So she really wanted to hear that. She wants them dissolved. And she didn't know they looked unnatural, and she only had fillers once 7, 8 years ago. And people think that fillers don't last. They absolutely do. They last a long, long time, if not permanently. So it was important for me to bring this up to her. And I usually don't start diving into fat grafting and fillers if someone's here just for a hair transplant. But she, the conversation sort of moved that direction because the fact that I needed fat to restore the hair. And then while I was talking about fat, I just said, look, there's a slight unnaturalness to the cheeks. And for her, she was very grateful for that. She says, thank you for being honest and blunt with me and telling me something I couldn't even see. So that's important, is to have a very frank and open relationship with a surgeon. And I always say, look, I'm not here to force you to do something. I'm not here to do something that you may not want, but I need to offer you things that you may not even have known about. So hopefully this video about needs versus wants, low-hanging fruit, and these terminologies of understanding sort of my philosophy would be helpful for you as a prospective patient.